Kiran, the first thing I want to ask you is a Just Thrive question.
Okay.
So recently I had a thermogram.
Yeah.
And they found a spot that wasn't dangerous or anything looking. Just, she said, looks like I may have an estrogen excess.
Mm-hmm.
So she wanted me to go on primrose oil.
Okay.
I've been taking that. And also she wanted me to take another supplement. I can't remember the name of it, but basically it's concentrated cruciferous vegetables.
Oh, okay.
And Joni was saying that Joni, who also works with Just Thrive, she was saying that they're worthless because if your microbiome doesn't have the right bacteria there to handle the excess estrogen, it's not going to do anything anyway. So tell me, how can Just Thrive help with that type of thing?
Yeah. So ultimately, it's this constellation of bacteria called estrobolome that exists within your gut. That estrobolome plays different roles within the microbiome, but everything related to estrogen in particular. There's evidence that it metabolizes excess estrogen, but if you have dysbiosis, it can actually reactivate estrogen that's being dumped into the gut to be excreted from the body.
Okay.
Right? So it seems to play both roles. Now, increasing diversity in the microbiome is related to balancing out estrogen by metabolizing it in the gut and removing it from circulation. The way what your body does with estrogen is, your glands will produce estrogen, circulate around the body, and then it's dumped into the gut to get rid of it. So in order to create a imbalance within the gut, the estrogen, once it's dumped into the gut, either has to be reactivated and reabsorbed, so then you're building excessive amounts of estrogen, which drives estrogen dominance, or it has to be metabolized like it's supposed to in the gut and then removed from the body. So that metabolization of estrogen is dependent on increasing diversity in the microbiome. Increasing intake of cruciferous vegetables can help with increasing diversity. There's not a whole lot of studies on it, but just theoretically, yes, it should. Because you're feeding different types of microbes with those macromolecules.
Oh, okay,
right?
got it, yeah.
There's a lot of fiber in those types of vegetable sources, so they feed other groups of bacteria that you may not be feeding with your conventional diet, certainly with diets that are high in protein or fat. Right, so those cruciferous vegetables will bring about other microbes. But the Thrive plays a big role because we have studies showing that when you increase the intake of spores or start the intake of spores, and there is some dose dependency to it, so you can bump up your dose a little bit, will actually increase the diversity of the microbiome quite significantly, thereby helping balancing all the hormone issues.
So should I take more Just Thrive? And should I also take this supplement as well?
The primrose oil?
Well, that plus the other one that is basically the concentrated cruciferous vegetables. Should I do both?
The concentrated version. I would think almost you'd be better off just eating more cruciferous vegetables and taking your Thrive.
Okay, that's so funny because, a lot of times they say you shouldn't be eating too many of these cruciferous vegetables. Some people say that because there's anti-nutrients in those sometimes, especially if they're raw. So how does that play into it? Do you know?
Yeah, so lectin sensitivities and things come into the picture, right?
Yeah.
If you simmer them for a long time with extra virgin olive oil, that seems to negate most of the issue.
Yeah, cooking. Yeah, that's true. Okay. All right, great. Tell me more about a healthy urinary tract and how Just Thrive can help prevent UTIs and bacterial vaginosis.
UTI issues come from a couple of different things, right? So you could develop a UTI because you're dehydrated, because you're not peeing enough. And part of peeing is also cleansing out the urethra. So that flushing of the urinary tract.
Keeping things moving through there.
Getting things moving. For women in particular, the proximity of the urinary tract is so close to the anal cavity, so you've got continuous exposure to microbes like E. coli that are in the anal area, and so that can go up the urinary tract. Everything's internal for women, so that makes it a little more complicated. It's more moist, it's internal, it's a much easier area for places to breed and grow and then move up in the wrong direction up the urinary tract. Men, it's different. We have stuff externally. We've got a longer urinary tract, so it's harder for things to get in there and cause urinary dysfunction or UTIs.
So that's why women have more.
They tend to have more
UTIs
UTIs because of that. Yeah, just the physiological structure alone. That's a big driver. Now, your body is constantly dealing with bacteria in the urinary tract, right? We used to think there was this old adage that urine was sterile. It's not. Right?
Really?
There's nothing in
I
your
thought
body
it
is
was
sterile.
too.
No, nothing in your body. Your blood is not sterile. Your blood has 1,000 bacteria cells for every milliliter of blood, and we have 5,500 milliliters of blood. Right? So that's how many bacteria we have floating around in our blood. 1,000 times 5,500. That's a lot.
Yeah.
We used to think that our cerebral spinal fluid is sterile. It's not. It's full of viruses, bacteria, everything, right? So nothing in the body is sterile.
Yeah.
So we're constantly dealing with microbes going up the urinary tract, but your immune system, your mucosal structures, all of that fight it off all the time. Peeing helps by flushing it out. So if any of those things go imbalance, meaning you're not peeing enough, or let's say you're peeing enough, but your immune system is dysfunctional, your mucosal immune system is dysfunctional, you're going to increase your risk for that turning into an infection, right? So just like infections in the body, just like cancer even, we are constantly fighting it all day long, right? There's cancer cells being developed in your body every single day, multiple times a day.
Yeah.
But your immune system detects it, it finds it, and shuts it down. So it's all about keeping that immune system up and functioning. The central command for the immune system is in the gut, right? Almost 80% of your immune tissue is in the gut. All of the sampling that occurs in terms of how our body understands the world around us starts in the gut. And the mucosal immune response, which covers every mucosal surface in your body, including your urinary tract, the master command for that is in the gut. Right, so if your mucosal immune system is going to be robust and be able to fight off these infections that are constantly being generated, then your gut microbiome and your gut immune system has to be in tip-top shape, right? So the best way to try to reduce your risk of these kind of recurrence issues is to have a really healthy gut microbiome and an upregulated and functioning immune system in the gut. So probiotics like the Just Thrive can play a big role in that.
Okay, great. Same with yeast infections. We've talked about that before specifically. There's another video about that. What about a young mom who is maybe having trouble getting pregnant?
Yeah.
Wants a healthy, pregnancy, labor, and delivery. How does a healthy gut affect that?
Yeah, so a lot of fertility has to do with what microbes are living in your vaginal canal, right? So having the right lactobacilli, and it's interesting to note that most women are dominated by one species in the vaginal canal. It's one of four. It's either Crispactis or Gensai, one of the four main lactobacilli. But most healthy women with the healthy vaginal flora will have a predominance of just one bacteria. Make up like 90% of the microbes in there, which is a very unique thing in the body because very few other areas I can't think of any other areas in the body where you have an entire ecosystem dominated by one microbe, right? Everywhere else in the body we've got a pretty good amount of diversity. The only other area where diversity is not really a good thing is on the skin microbiome. You want a predominance of a couple of different microbes. But the predominance of that one healthy microbe, that's your vaginal microbe, is one of the determining factors on fertility because it changes how your hormone responses in your ovaries and how your uterus functions and the lining of the uterus. So all of those factors are determined in large part by that one microbe in your vaginal canal. Now,
determined by like which one it is or how much of it you have? Or?
How much of it it has, how dysfunctional it is, right? So if you've got a dysfunctional microbiome, vaginal microbiome, you've got too many other microbes in there, you've got yeast, you've got issues, all of that will change the ability to actually get pregnant. Because it'll change the hormone response, it'll change gonadotropins, it'll change how your uterus forms. All of these things are affected by those microbes. Now, the gut microbiome specifically has an ability to support the growth of beneficial bacteria in the vaginal canal. And it does that by feeding the vaginal bacteria with metabolites from the gut through the mucosa, also upregulating the immune response in the mucosa in the gut, changes the immune response in the mucosa in the vaginal canal. So it helps your immune system fight off other bacteria that are trying to overgrow in the vaginal canal, and it maintains the dominance of that one strain, right? So it's ecologically, from a microbe standpoint, that's a very uncomfortable scenario, right? Almost anywhere where you look at bacteria outside of places like hospitals where they're constantly sterilizing the environment, you don't have a predominant species in a microbial ecology. You tend to have a spread of many different species, right? You don't have one that takes up 90% of the cells. That is what's going on in the vaginal microbiome. So in order to keep all the other bacteria from constantly trying to take over, your immune system has to function in the vaginal microbiome to bring down the growth of those other microbes. So it's a constant battle between your immune system and the microbes that live there, trying to maintain that predominance of the one. And again, 80% of your immune system is in your gut. So that priming of the immune system, keeping it up in tip-top shape to help maintain the healthy vaginal canal, is done in the gut.
So a lot of women, you're saying, that who can't get pregnant, it's they overall are unhealthy as far as their immune system, because
they could be, yeah. I mean, it's one of many factors, right?
Yeah,
I mean,
there's lots of causes.
There's lots of causes, but it's certainly something that people need to be paying attention to.
This would be an easy, non-invasive thing to try for a woman to just take.
And if you're doing other things, like if you're working with a fertility specialist and you're doing all these other things that could be really beneficial, it would behoove you to focus on the gut as well, because you don't want anything getting in the way of having that happy, healthy child, right? Getting that next pregnancy. So this is an important thing for people to pay attention to, in addition to the other things they may be doing.
And most conventional docs probably don't even know about this.
Absolutely. This is all very new stuff, yeah. And
then so they get pregnant, and then their healthy gut will help, obviously, the baby to be especially healthy. But then even, super important is then when they come through the vaginal tract, right? You've told me that before.
Totally, yeah. Then you're giving the baby, the baby's life in general and the baby's health outcomes, of course, from birth all the way till the baby's a full-grown adult, is determined in large part by what kind of microbes the baby picked up moving through the vaginal canal and through birth.
Yeah.
So mom's duty is to pass on the best and most robust microbiome to the child. So even if you're not focusing on your gut for the fertility reasons, let's say you're able to get pregnant in other ways and you have a good stable pregnancy, you need to keep in mind that you're passing on those microbes to your child. Are you going to pass on microbes that are increasing the child's risk for anxiety? Are you passing on microbes that are increasing them for allergies, autoimmune disease, obesity? Or are you going to pass on robust, healthy microbiome that's going to protect the child and allow the child to thrive?
So you told me before, but remind me, babies born by C-section, there's either they've did experiments or whatever with trying to get that mucosa in and around the baby's mouth and stuff, right?
Yeah,
to
so
still benefit even though they were born by C-section?
Yep, and that can be done now, right? So most hospitals are pretty open to it now. Where you actually
do they do it regular though, or is it?
It's not offered. No, you have to be a proponent of it. You have to push your doctor to do it. Yeah.
First of all, okay.
Yeah, if you're, I actually was just having a conversation with a couple that I worked with that did that, where they were explaining how. Prior to going to the hospital, because they had a planned C-section for numerous reasons. Yeah. And so prior to going to the hospital for the planned C-section, the husband and the wife in the bedroom were taking out all the sterile gauze and figuring out ways how to shove it into the birth canal. And so they were doing all of this funny stuff that's going on, and they were putting it into the birth canal, and then they made their way to the hospital. And sure enough, as soon as they pulled the baby out through the C-section, to the cesarean incision, then they took the gauze out and they wiped the baby down with it.
In their mouth?
Around the
their
mouth.
Skin?
Yep, everywhere.
Okay.
Everywhere you can, especially in this upper respiratory tract area.
Right.
You want the baby to ingest some of that bacteria. Now, then the important thing is you wipe the baby down. You don't want to hand the baby to the nurse and then they take them and clean the baby off. You want to stay with that stuff for a little bit.
Because they wipe them off pretty quickly and
they wipe them off
try to get them all cleaned up.
Yeah.
I wish I would have known all this stuff. I didn't have any C-sections, thankfully, but still, there's so many things, that you wish you would have known.
And then, of course, breastfeeding.
Yeah, that was my next question. How does that affect? Tell me more about that.
Yeah, I mean, if a baby's not breastfed, it's significant increased risk for autoimmune conditions, immune dysfunctions, metabolic syndrome. Bottle-fed babies tend to be more overweight, have more metabolic dysfunctions. We also know that mom's milk has over 200 oligosaccharides in it, so really important prebiotics to help seed those initial bacteria that come in. We also know that mom's milk contains up to 600 different types of bacteria itself. So it's a really important source of the baby's microbiome. So passing through the birth canal is part of it. Then for the next year, the baby's going to continuously get new and good microbes from mom's breast milk. So
how does a healthy gut make sure the mom has enough milk?
So a lot of
it just affects everything.
It affects everything because, I mean, number one, in order for mom to produce milk, adequate amount of fat, protein, calories, all of that in the milk, mom has to be able to absorb and assimilate the nutrients she's eating, right? We know that the old adage of you are what you eat is actually wrong. It's you are what you absorb.
Right.
You can eat all the healthy food you want. If you can't break it down, assimilate it, and absorb it, you're not getting the benefit. And that part is determined by inflammation and the function of the lining of your gut. Right? If your gut is inflamed, like in the case of celiac people who have a lot of damage to the microvilli in the gut and to the mucosa, they cannot absorb fat-soluble vitamins. Even if they're taking in supplement form, the absorption rate goes way down, and so they tend to have higher incidence rate of tooth decay and osteoporosis and all that because they can't get their vitamin K and their vitamin D into their system. So the ability to absorb and assimilate nutrients is going to be critical for mom to have really good production of milk and then high quality milk as well. And that is dependent on the health of the gut. So everything comes down to the gut.
Yep, it's so important.
And then one more thing, because in the first 6 months of life, the baby has no immune system of his or her own, right? The baby's completely dependent on mom's immune system for protection. And all of that immune protection comes through breast milk, right? Breast milk has the immunoglobulins and all of these important things that the baby needs to fight off the viruses and bacteria and things that the baby's going to be exposed to in the first 6 months of life. After 6 months, the baby's own immune system starts to take over and adds protection. So in that first 6 months, it's absolutely critical not only to be breastfeeding because you're providing immune protection to the baby, but then your gut has to be healthy because your immune proliferation, your ability to produce antibodies and B cells and T cells and macrophages and all that is in the gut, in the Peyer's patches of the ileum. And those areas require in communication with a healthy microbiome, and inflammation in that area drives inflammatory response, so you're passing on more allergic type of responses to the baby, so then the baby's responding in a more inflammatory allergic way to things around it, developing eczema and diaper rash and food allergies and all of those things. So yeah, we cannot overstate the importance of mom focusing on her gut for the health of the baby.
Right, and eating that great diet is so important as long as your gut is in a good enough condition to absorb everything.
Yeah, just your food choices is only 50% of the story.
Yeah.
And unless your body can actually utilize it, then you're not getting all the benefit from it.
Has there been much research on the best method for wiping the vaginal mucosa for those C-section babies?
So the study that was done, I think there's two methods. One is you put the sterile gauze in the vaginal canal, right? While you're going through the C-section and the supposed birthing process. You're going through the Braxton Hicks contractions, and maybe you're going through actual contractions. The water breaks, all of that happens on that gauze. And so then once the baby's born, you pull out the sterile gauze and then you wipe the baby down. That's one method. The other method is once the baby's born, you actually just go in there with a swab and swab as far and as around you can in the vaginal canal and swab the baby around the mouth and nose. And I think the study done at NYU used that swab method.
So that's pretty simple.
Very simple, yeah.
Yeah, you don't even need to have a special kit or anything for that.
Nope.
So, and is the timing important? Like, if the timing has to be at the time
Right
of
away,
birth?
right?
That's the ideal time, yes.
Or could you use someone else's?
Another person's, another woman's?
Yes.
You could. The only problem is then if that mom whose child it is, whose vaginal microbiome it's not, if she breastfeeds, then that could provide conflicting bacteria, because mom's vaginal bacteria are a mimic of her ecology. And so if she's breastfeeding, then she's providing her ecology to the child, so it could be conflicting.
So the vaginal microbiome, is that kind of a regional thing? Like, gee, people from the Northeast tend to have this one and people from the South have this one, or Europe, or is it just actual individual?
Believe it or not, it's based on race.
Oh, okay.
Like women of African descent, African American women have different vaginal microbiomes than Caucasian women. Hispanic women have different vaginal microbiomes than Caucasian or African American women. That you can actually class women based on their ethnicity and what their vaginal microbiome looks like.
And is breast milk that specific too? Like if you're using donated breast milk, could that be a conflict of interest between the two things too?
That would be a little less, because if you gave birth to a child vaginally and then you're using someone else's breast milk, you're actually getting a lot more bacteria over time through the breast milk. So it'll end up, the child's microbiome is going to end up looking more like what microbiome is in the breast milk.
Oh,
right? Because
that's exactly the opposite of what I thought.
Yeah, and because that initial inoculum that comes through in the from the birth canal is just the initial inoculum, right? It can be overcome easily with an exposure to antibiotics, or in the case of, in what your question is, breast milk, right? Because breast milk has loads and loads of bacteria and prebiotics that are coming in every single day in large amounts, 3, 4, 5, 6 times a day, depending on how much the baby's feeding. So it's tricky because it's similar to fecal transplants in that it can be helpful for certain conditions, but the microbiome is so complex, you don't know what you're transferring on it, right? So if you don't know every possible thing about the donor, whose breast milk it is that you're using, you don't know if you're transferring some risk for an autoimmune disease or something like that on that microbiome without really understanding who the donor is. So that's part of the problem with a lot of these kind of very large scale sharing of biomes, is we don't know what you're transferring on those biomes.